Hello and welcome to the Texas Mind Exchange podcast. My name is Cody Gould and I'll be your host. Today we were joined by Andy Miller of the Austin Child Guidance Center. We talked about how they are serving our community by focusing on children and the families of those children. We talked about funding and the future of mental health in Central Texas. So without further ado, welcome to the Texas Mind Exchange. Just as a reminder, all statements expressed by our guests on this podcast are their own and should not be considered official views or opinions of myself or anyone else at Texas State University. Andy, thank you so much for joining us.
Sure.
Coming down to San Marcos.
Yeah.
I know that the drive is not great, but I guess
it was great this morning. I can't complain.
So just for context, you're the executive director of Austin Child Guidance Center.
I've been with ACGC for 2 years now.
2 years?
Mm-hmm.
Would love to hear just an overall kind of, I don't want to say value prop, that's the only word coming to my mind.
Sure.
Of ACGC, how do you serve the community? Kind of just overarching, and we can go from there.
Okay. Well, Austin Child Guidance Center itself has been around in the Austin and Central Texas community for about 75 years. In fact, 2026 will be our 75th anniversary. And during that time, we've always maintained that providing access that is affordable and accessible to children and families that need mental health support. What that's looked like over the years has evolved based on what the community needs. But today, our core value proposition is we provide high quality, affordable, accessible mental health services, which usually means therapy by licensed clinicians to children and families, and a special emphasis on those who may struggle to find access. So people who are trying to use their insurance, we accept all forms of insurance. People who are enrolled in Medicaid and can't find a provider. All of our folks take Medicaid. And we also run a sliding scale fee-for-service model that can go all the way down to zero based on the family's income qualifications. We do also get money from very generous entities, some public, some private, that actually helps us to underwrite care for some folks free of charge, no matter what the circumstances. For example, we have grants from the state of Texas that help us serve any child that's been the victim of a crime with mental health services at no cost to the family whatsoever. So that's really the core of what we do, and every other thing that we've done over the last 75 years, has built on that, but that's always been the core of our services.
That's amazing.
Yep.
I guess the span of folks that you help seems to be very wide, from family members to children.
Yep.
Do you have individual family members that come in by themselves, or do they always accompany a child?
The child is typically what we call our index client. So everything is centered around the child. Definitely if the child isn't the one that needs the counseling, then we will work with the parents or the family members in support of their needs. But it's typically something around the relationship with the child or the needs of the child. For example, I'll disclose that my relationship with ACGC started back in 2017 when my husband and I were really struggling with supporting our son who had just been diagnosed with ADHD. Like, our parenting instincts were not working. Our skills were not sufficient to really support his differently wired brain. And so we came to ACGC and participated in a parent support group and kind of educational group that they had to really teach us about, what are children with ADHD experiencing? How do they respond to inputs? How is that different from kind of differently wired kids? And how can we best show up as parents for him? So it wasn't his issue per se. It was more, we didn't know what to do. So there are cases where, the child isn't the one in need of the quote unquote therapy, but they typically are the client that we enroll in services, and then we serve anyone in the family that needs support.
Gotcha. And we've been working together for probably about a year now. You were on our advisory board. to make sure that I guess our advisory board was put together by local organizations, or I guess more executive directors of local organizations that were implemented to help us understand the needs of the community and what we could do at the Translational Health Research Center to actually implement something that would meet those needs in some way, that didn't cost a lot and just really got people together. That was the creation of our Mental Health Community Collaborative, which is a virtual online series that brings people together, specifically from the mental health perspective. But something that was a big focus of that Mental Health Community Collaborative, or of it, is the idea that Austin and San Antonio are so much closer and have so many overlapping counties and people that live and sleep and work in all different, different regions, but it's all kind of one big mega region. We just don't count it as one. And so I know that you've told me that you all serve a vast variety of counties outside of Austin, even though it's Austin Child Guidance Center. But would love to hear more about that. I know that Travis County might be the focus, but you are kind of hitting some other aspects around.
It's interesting. We've evolved over time as well. And it's true. We are located. Our headquarters and our clinic is in Travis County. We're right at the corner of 45th Street and Lamar Boulevard in Austin. So it's very accessible. It's very near a lot of historical mental health services. We're going to be right across the street from the new state hospital. But, as the population has continued to migrate around the region for a number of different reasons, we've seen our area of service expand. So now we say we serve the full 10 county Central Texas area. Because we know there are a significant number of folks who can no longer afford to live in Travis County. So they're moving to Hays County. They're moving to Williamson County. They're moving to Bastrop. And those are the communities also that have struggled with access to resources and may not have them built up locally. So we continue to provide those supports. Now, the challenge has been, how do we not increase the burden on those families to travel into Austin, because traffic is also a big concern, especially for families who may not be able to afford to take off work once a week and travel all the way into Austin to bring their kids to therapy. So we have, as a result of the necessity during the pandemic, had to put in place all the technology to do teletherapy. So all of our services, all the therapy services we provide can be either in person at our clinic or virtually. And so our therapists can do teletherapy. We even have a technology lending program for families who may not have the appropriate technology, the tablets or the hotspots. We can lend that out if a family needs that support and wants to do teletherapy. We can give that to them as well. So we typically serve those other communities outside Travis County with teletherapy. Unless the family's going to travel in. My goal is really to continue to create access points for families to be served locally, whether that be we send our therapists out or we build relationships with therapists locally in some of these other counties and affiliate them with ACGC so that we can refer clients to them. Because we know that there are highly skilled, high quality therapists that provide great services locally, but they may not serve Medicaid clients, or they may not be able to take insurance because of the kind of financial reality of it's very difficult to make a living with the rates that insurance company reimburse for therapy. So there's really practical reasons why a lot of therapists don't take insurance, where we can work with them on how we can take insurance for the benefit of our client, but then also compensate them for providing our client services. So that's kind of our next goal, is how do we continue to build capacity so that we can serve in a much more client-centered way folks that live outside Travis County without requiring them to come in to our offices.
Yeah. Would that, I guess this is kind of going off the top of my brain, but is it in scope to think that you want another satellite office, or are you thinking more just like continue to expand some of those remote services?
Building infrastructure and bricks and mortar that need to be maintained, I think is an embedded cost that we don't need right now. I would much rather build strong collaborative partnerships with other organizations that have space, have identified that their children and families have mental health needs that they would like to help meet, and affiliate some type of kind of shared space, some co-location, even some drop-in, supports that we can provide. So I envision it more like ACGC becomes embedded in services that are being provided by schools, after-school programs, community centers, other child and family serving organizations, that we can provide that expertise and supports for those families without us having to build yet another place that needs to be maintained, has costs associated with it, and is quite frankly just another place that families have to go.
Yeah. I think that's a great idea. Not taking in the cost of building something new, but also leveraging the community that is already there, that is serving, and you kind of just coming in and helping even more. That's such a great idea.
It is already very expensive to provide one-on-one therapy for children and families. And again, the reimbursement rates from insurance providers and Medicaid is not sufficient to cover all of those costs. So anything that we can do to share expenses, bring those costs down, make it a more efficient, sustainable enterprise for us, just means we're going to be able to serve larger portions of the community for a longer period of time. And that's really the goal. It's not to build, brick and mortar satellite offices all over the community with all of those embedded costs. It's really, how can we expand our services to meet the needs of the population? Because like the entirety of Texas, Central Texas, almost every county has been designated as a mental health shortage area. I think out of 254 counties, 250 are mental health shortage areas.
Yes.
So if you then layer in mental health that is focused on children, or capable of supporting children and families, then that number gets even smaller. Then you layer in the need for bilingual services for families who speak Spanish. That becomes even more of a need, because we are not producing enough licensed professionals in this state to meet the growing needs of families. And then you get much more specialized in language needs or cultural competency or different populations. It becomes very difficult to meet the needs.
Yes. As someone who's in school for this, I'm trying to...
Congratulations.
Thank you. Haven't gotten there yet, so we're working on it. But you bring up a really good point, and it was actually something in line with what I wanted to talk to you about, which is the challenge seems to be that the licensed professionals will never match the need that is out there.
Right.
Even if we get thousands and thousands of more licensed professionals, it will still almost always be a shortage, just because of the pure amount of assistance that's probably needed. So then my question is, it's amazing that we have more people going into this this career path. With that said, are the shortcomings in education or the shortcomings in doing away with stigma as much as you possibly can? Like, where can we match the need that you see and that I see as well, but without leaning on licensed professionals for everything?
Sure. It's a really great point, because, while individual therapy is absolutely necessary, recommended, effective for some folks, it's not the only tool in the toolbox. So this is where I can kind of take off my, ACGC hat, and running a clinic that provides therapy, and put on kind of my public health hat, which is more my background and training. And we've got to have a much more comprehensive kind of toolbox to address the mental health needs of the community, because it's not just therapy. The solution is everybody doesn't get therapy, or everybody gets therapy. That's not sustainable, and it's not advisable either. But there's a lot that we can do on the prevention side. There's a lot that we can do on the health and wellness side that has mental health impacts. And we've got to be able to support those efforts to prevent the things that we know are preventable. For example, we know during the first 3 years of life, making sure that babies are protected from adverse experiences. because when a child under 3 experiences significant trauma, it has the capacity to rewire that child's brain permanently and create circumstances that make it much more difficult for them to deal with adversity later in life, which then could lead to significant mental health issues, which then would require individual therapy, sometimes very intensive for years. So what can we do on the early side to protect those babies' brains, support parents of new children, so that we reduce the risk of those adverse experiences and help nurture those brains to be much stronger, much more resilient to challenges later in life? One of the programs that ACGC implements right now is called our Infant and Early Childhood Program. And it's a growing program where we send our, again, trained therapists into childcare centers. These are folks who are supporting families by caring for their babies, their infants and toddlers while they can go work. So they're with them significant numbers of hours in the day, oftentimes with staff that are very young, maybe not in receipt of a lot of training, either initially or continuing education. And they have to manage a lot of administrative logistics. So one of the things that we've learned is that when a child is dysregulated in daycare, they oftentimes get a few chances. And if they don't improve, they get kicked out. And what happens then is the family doesn't have reliable childcare. It impacts the family's ability to work, provide for resources. They get further economically disadvantaged, find it harder to find a job, maintain a job. And then the child suffers as a result of now living potentially in poverty. So the reality is it's not a viable solution. It's not sustainable. It's not good for the family. It's not good for the community to kick a child out of daycare that is emotionally dysregulated or experiencing something that is not enabling the staff at the daycare center to manage the classroom dynamic. And again, these are not folks who are certified teachers or who may have gotten a lot of training. So they're doing the best they can. Our therapists in our infant and early childhood program go into the childcare centers and embed themselves with those classes for months at a time and do something called consultative supervision, where they work with the teachers, they work with the administrators, they observe the classroom, and they can coach, they can advise, they can help adapt policies and practices so that the centers themselves become much more trauma informed. They become much more nurturing and adaptive to the needs of kids. And those kids stay in care longer because the teachers, the facilities are able to meet their needs. They don't just say, okay, we can't manage this. Your child is getting kicked out. So we have seen that program grow significantly in the past 5 years. It initially started with some partnerships with Workforce Solutions because they really had a vested interest in, childcare centers that they were providing subsidies to make sure that the folks they were placing in work had good places to take their kiddos. Since then, we have proven to the city of Austin and to Travis County that this program works, and they're continuing to invest more public dollars because, again, they have a vested interest in people going to work, staying employed, making a living, contributing to the community. So we're seeing much more many more requests for that program. So it's a growing initiative for us. But that's much more on the prevention side. Yes, we can identify families in those settings that may have needs for individual therapy. But by and large, what we're doing is we're changing the environment that these kiddos are in and identifying maybe really early needs so that we can address those so that when those kids are teenagers, they haven't spent the last 10 years with trauma that hasn't been addressed, sometimes being perpetuated, and then need intensive therapy, at that point or later in life.
Yeah. That sounds like an amazing idea. Yeah. And is there an age group or age that all that kind of stops at? I might have missed that.
So, daycare centers, largely are the pre-K, so once someone hits 4, they're usually, in a pre-K pipeline or getting ready for kindergarten. So it's and schools are great. Schools are a great place to identify, children that may have needs and how to provide supports. There are great organizations out there working with schools right now. Schools are doing a lot to identify and provide supports. Sometimes legally they're required to. I mean, there's been lots of attention in Texas about, are we doing enough for children with special education needs, providing the right accommodations, providing the right supports. But schools are the place where that can happen. Prior to school, though, again, we're talking about the first 3 years of a child's life. They're either at home with their families. Hopefully they're going to a pediatrician's office, for checkups and when they're sick. But we know sometimes families struggle with access to healthcare. So daycare centers are a place where children can be observed. There can be recognition that there are needs and supports provided, but only if those places have the capacity, have the training, have the systems in place to do that. And that's what our infant and early childhood program does. It really kind of adapts the whole setting so that those children are provided not just a safe place to be while their parents work, but it's actually nurturing, trauma-informed. We can provide the support so that if something's going on those first 3 years, we can intervene and hopefully prevent something more significant from happening in the future.
Totally. And my brain immediately goes to it's destigmatizing therapy at a really young age. Yeah. As long as you are able to communicate who this person is and why they're there to help you. Right. Because if you have such early exposure to someone that helps you in that way of I don't really understand what's happening up here. Maybe I'll talk to so-and-so. That just makes it so much easier to get back in and know where to go later in life. Yeah. And so I guess that leads me to ask you, is there desire to build out this initiative to happen a little bit later and a little bit later? Because I know that school counseling kind of overlaps with this a little bit. Yeah. But for it to be so embedded in this in childcare, it just seems like an amazing idea to just fold that into schools at an even deeper level. Yeah. So I guess
I think the more we learn about brain development, I think the more many become convinced that this is essential. But this is still in the grand scheme of things, a fairly new field. Yeah. It wasn't that long ago that we thought that babies, under 3 were blank slates. It didn't matter what happened, as long as once they became more cognizant of their environment, you just needed to provide them love and support. They just kind of never remembered. It didn't really impact them. And we know now that nothing could be further from the truth. Adversity and trauma that happens to infants can rewire their brain. It has nothing to do with strength of character, will, love and support, that they receive later. It literally can rewire their brain. It has to do with, brain chemistry. It has to do with biology. So the more we learn about that, I think the more we see that, this isn't just about keeping children occupied and safe while their parents are at work. We really need to protect babies' brains up to the age of 3, and anything that we can do to reduce adversity and trauma is going to have huge dividends later in life. I think it's also true as children are developing, because we know, prefrontal cortex doesn't fully develop until age 25. So this notion that you're an adult at 18, or that you can drink at 21, and you're an adult, your brain is still developing. So the more we learn about the brain, I think the more we see that some of these supports are going to be needed for a long time, and we need to put in place systems that identify early when there are signs of dysregulation or things that may have happened that could have lasting effects, and get folks to understand that it's not about will, it's not about emotional resilience, that you're inherently born with. It's not a failure if you are experiencing mental health issues. Sometimes it's a biological function because of something that happened to you. So having a trauma-informed approach, which basically means, you're not looking at someone as to what's wrong with them. You look at them through the lens of what happened. What happened to you? And what could be the impact of whatever happened. So it's not about, labeling a person as something's wrong with them. It's really acknowledging that there are traumas and things that can happen to people that significantly affect them biologically in their brain that we need to start addressing. If it happened to their heart, if it happened to their foot, we would provide supports. We would send them to, a medical professional to address that issue. Just because where it happens to them biologically is in their brain, we think somehow it's an indictment on their character, on their, upbringing, on their will. It is a brain as an organ that can have significant trauma when something bad happens. And we need to acknowledge that can if that happens before the age of 25, it really can affect, someone for the rest of their lives if it's not addressed. Now, if something bad happens, it's not a predetermined thing. Like if something bad happens to you, if you experience trauma or adversity in the first 3 years of life, it doesn't write your whole history or your future for you. But what it does is tell us that, okay, now you have experienced something that increases your risk for certain things to happen. And we have to acknowledge that and honor that and do what we can to bring that risk down.
Yes.
Just like if you receive a sunburn early in life, we know your lifetime risk of melanoma has now tripled. So what that means is you need to go to the dermatologist. You need to have your skin looked at on a regular basis by someone who knows what they're looking for, because you're now at higher risk. Doesn't mean you're going to get it. It just means now we have some things that we need to do in order to prevent this from happening. Yeah. Same thing with the brain. We know if you experience significant adversity during childhood, you are at higher risk for a number of mental health issues later in life. We need to monitor for that, and we need to provide you supports to mitigate some of those things if they start showing up.
Yeah, absolutely. As you were talking, all I could think about was trends that you might be seeing. Because I know obviously there's a lot of talk about different types of trends that are mental health trends that are not so much what I mean by that is different diagnoses and things along those lines. And from someone who is running a clinic as big as ACGC, over the years, and you might have, I guess you joined 2 years ago, so you might not know the long-term history, but I'm wondering, maybe even just anecdotally, are you seeing any trends?
Yeah. Yes, absolutely. And in fact, there's some research that's coming out about some things happening just in the last 5 years. I mean, since the pandemic, since the proliferation of smartphones and devices that we know, children and youth are spending more and more time on screens, and the effect that it's having on the wiring of their brain. We are starting to see some trends. We are starting to see, and quite frankly, some of our methods of detection are getting much more sophisticated. So things that we didn't recognize in the past, we're getting better at recognizing. So it may not be that these things are actually significantly increasing. It's just we're getting better at noticing it. So we're able to count more cases. Just like with breast cancer, as our screening technology gets better, we're able to identify smaller and smaller and smaller changes in the cell. It doesn't have to be a big tumor anymore. That doesn't mean that there's more breast cancer per se. There might be, but what it also means is we're getting better at detecting it. And when we get better at detecting it, there's an opportunity to intervene. Same thing with ADHD. Same thing with autism spectrum disorder. Same thing with kiddos with executive functioning delays. We're starting to recognize what this is earlier and what we potentially can do about it. So we have definitely seen, I think with some of the statistics I have seen is 60% of folks under the age of 25, kids under the age of 25, are still living at home with their parents. That's a generational shift. When I was born in 1970. I left home at 18. Never really never came back. Went off to college. Got a job. I was able to do that. By and large, for a number of reasons, whether it be economic, societal shifts, developmental delays. What we're just not seeing, that's not the norm anymore. People are staying at home longer on their parents. And as a society, we're responding to that. Kids can stay on their parents' insurance up until age 26. I couldn't do that, when I was young. So we're recognizing that families need longer, time. Children need more time under their parents' support than maybe before. Economically, we're seeing it's really hard for young people starting out to buy a house. So, I mean, it's, when we put things out of their reach, I don't know that we shouldn't be surprised that there are real societal shifts. What we are seeing is there are a number of things that we're getting better at recognizing, things like ADHD, folks who may be on the autism spectrum somewhere, and being able to provide those supports to families so that their children do have an opportunity to thrive. Not launch at 18 like we did back in the 70s and 80s, but at the same time, have an opportunity to pursue their goals independently, whatever those might look like. So what can we do to support those families? Another thing that we do at ACGC is we provide testing. So psychological assessments are kind of the gold standard for diagnosing a number of different issues that once we understand are present, we can put in a number of supports. So if it's ADHD, if it's autism, we know that, if you have that diagnosis, you can go to school, a public school, and say, hey, I need more time on tests. Hey, I need individualized support in the classroom. Hey, I need a individualized education plan with all of these other accommodations in place. But you have to have that test. And what we know is that test can cost up to $4,000 for families because it has to be conducted by a trained licensed psychologist. And there are not a lot of folks out there taking insurance to provide that test. Schools, we know, are required to do some testing when there's a suspicion of something that might be happening. But capacity, how quickly can that be done? How comprehensively can that be done? Depends on where that child goes to school and the supports in that district. So what we're seeing is there's a real potential for folks who have economic means, their children get tested and get support. Families who don't, their children continue to struggle in school, their needs don't get addressed, and that can set them up for things that happen later in life that don't well prepare them. So, yes. For example, if as I say, you paint two pictures, one family has all the money that they need to live a robust life, and they think their child might have a ADHD. They can go in, get the testing done, get the diagnosis, go into school, get all the supports they need. That child gets, all the accommodations they need, extra time on tests. They do well in school. They start making good grades. They do well on the SAT. They get into college. They have all these opportunities. A child that doesn't have it, their family can't get that $4,000 together because maybe they're on Medicaid, or maybe they work and they have insurance, but they can't find a psychologist that takes Medicaid or insurance. And their school district maybe has a long wait list to get those testing done, or they don't have the supports in place to even do the testing. That child will struggle. That child doesn't get the test, doesn't make good grades, doesn't get the supports, doesn't get into college. I mean, that's a very kind of linear path, but it's a comparison where just because someone has access to money, that child has the supports, another family doesn't, they may struggle. So what ACGC does is we provide those psychological assessments. We have psychologists, PhD trained psychologists on staff, provide these assessments. We take Medicaid, we take insurance, and we do a sliding scale fee. So we bring those costs down for families and make it much more accessible. And sometimes they pay nothing. But at the end of the day, they have a diagnosis. If there's one there that they can then take into their school and say, hey, my child needs supports. I've got this diagnosis.
Yeah. Well, it sounds like to me, one of the biggest challenges is that financial burden, which is really obviously unfortunate.
It is.
And amazing that you have the ability to do something about it.
Yeah.
And most of that's done through like what you said, insurance and donations, things along those lines.
I mean, it's fortunate that we are a nonprofit organization. So we're a nonprofit 501c3. So we have the ability to not only provide the services, we're also a fully accredited with the Joint Commission. We're a behavioral health center. We have to meet all the regulational requirements of a healthcare center. So comply with HIPAA, have electronic medical records, do billings, do all of that stuff, protect patient privacy. And we have the ability to write grants to private foundations, to work with public entities like the county and the city, the state, and get contracts from them to provide services for folks in those communities. We also have the ability to bill. So we submit our billings for insurance, and then we can ask the community for support. But I will tell you, it requires all of those things in order for us to make the business model for this clinic sustainable so that I can ensure that we have a highly trained, highly competent staff to provide these services. And what I've seen is it is really difficult to maintain.
Yes.
The system itself does not support the ongoing functioning of a clinic like ours. That's why we have to go to the community and say, won't you support our services, and help families in need? Because just through billing insurance and through public contracts, the numbers don't work. And so ACGC couldn't exist otherwise. So I'm really fortunate that the community has responded and does provide us with that support. But what that tells me is, like, our local hospitals don't work that way. Our cancer centers don't work that way. Yes, they ask for support, but it's usually to develop new technologies, new buildings, increased capacity. With mental health, I think we don't see a sustainable system. We see lots of services being provided by folks either in small group practices or maybe individually or within a larger healthcare system. So that's a place where I think a lot of behavioral health happens is in larger healthcare systems, because it can accommodate through all the services it provides. It could have some programs that maybe don't earn as much money. Other programs earn a lot of money. So it can kind of embed those in a more comprehensive healthcare setting. But for individual clinics and people who are looking for specialized care, sometimes it can be really challenging to find someone who not only can do what you need them to do, but who takes the payment that you have to offer.
Yeah. Yeah. The more I learn about it, the more I'm noticing this trend as well, which is sometimes the misalignment between the community need and what the professional might take.
Yep.
And I guess that leads me to asking you, talked about this a little bit just now, but the future of that, because the future could be sparse in regards to the ability to continue to provide care. Which is really scary, but that's kind of where grants and things and such come in. But like you've said, is that method sustainable?
It's a great question, and it's probably the right question, because what my experience has been is those things, supports from private foundations, that can change. As foundations' priorities shift, funding may not be available any longer. And I think more and more foundations are looking at, like, how long are we going to be in this game? We've been funding this for a long time and we're not seeing any improvements or any changes. So, there are foundations that are asking the question of, like, what are we getting for this money? For our investment in the community, we're more interested in solving problems than just continuing to provide Band-Aid after Band-Aid after Band-Aid. So it's a relevant question that could have real impacts on funding that's available to nonprofits. Public funds change with the priorities of our elected officials. So it's great when we have folks in leadership roles, in elected roles in government that are saying we'll spend our tax dollars on this. But I think if we're seeing every day that can change with who gets elected. So all of a sudden, something that was a high priority that we funded for years, all of a sudden we're not interested in that anymore. And in some cases, it actually becomes something that we no longer believe in. And we're going to actively say, okay, we don't want to do that anymore, regardless of what the community need might be. So the last piece of it is insurance. We do not see mental health services reimbursed at a rate that is equivalent to physical health care. Even when legislation has been passed around mental health parity, we do not see it implemented in real life. Insurance companies do not typically keep what I would call kind of robust panels of providers in their network. They're not actively working to do that. And the reimbursement rates for services are not sufficient to cover the true costs of what it takes to provide that service by that clinician. So, you've got this really difficult scenario where, there's no easy solution. There's no silver bullet to say like, well, if insurance would just pay more, or if, we could just get more money from from government sources. Or, if foundation, we just need really, really, really wealthy foundations to just say, hey, we're going to fix this problem. We're going to solve it. I mean, it's going to take all of us. Mm-hmm. And until we start thinking about mental health on par with physical health, which has its own challenges. I mean, we're facing right now situations where it's really difficult for local kind of country hospitals to stay in service. So I'm not saying physical health is doing great either. Texas also is a primary care shortage provider area. I mean, many of the counties in Texas don't have enough primary care physicians to meet the needs of the population. So, I'm not optimistic that like a solution is on the horizon or we know exactly what to do. I think largely though, we as a society need to recognize that, this is my personal belief that healthcare is a right and mental health is part of healthcare. Mm. And we should be providing it to families, especially for children, because it's such a great investment. When we invest in children's health, including mental health, it pays huge dividends later in life. Yes. We prevent so many long-term issues from happening. We enable people to pursue things that they otherwise wouldn't have and benefit society in a whole number of ways. We prevent people from falling into really significant mental health issues that could result in, homelessness, drug addiction, alcoholism, lots of things that we know are burdens on society. But until we really invest in those things and recognize that, I don't see that we're going to ever have enough services to address those long-term issues, in people when they happen.
Mm. You're making me think a lot about the future. What does the future have in store? How do we really truly measure the return on investment that we might be kind of needing mm-hmm. to justify the cost of what mental health care goes through? But I'd like to, transition a little bit to talking about maybe the future of ACGC. Mm-hmm. And I know with emphasis of virtual care, you and I have talked a little bit offline about like AI and things along those mm-hmm. lines. Just because I think it's so interesting how different organizations are either pushing away from certain technologies or embracing certain technologies. I would just wonder from your perspective, like where do you see the evolution of ACGC going? And if that's too small of a question, which I don't think it is, but if it is too small of a question, things along the lines of the future of mental health care from your perspective.
Yeah. So I think for me, with ACGC in particular, because like I said, we've done a lot of things in the past and had a lot of firsts. Like ACGC was the first one to implement in the state a specific therapy program for children who were survivors of sexual abuse. I mean, we were the ones who pioneered that. We ran a day school at one point in our history for children who had mental health needs but could not thrive in a public school setting. So we've done a lot of things over time. I think you're bringing up things like AI. What it tells me is, we can continue to innovate. We can continue to think about how can we provide high quality services, but maybe in a new way, or maybe understand what's essential and really focus on that. So for us, it's a question of right now, we can't be all things to all people. We have to figure out what our role is in the larger mental health ecosystem space for children and families in Central Texas. We do a little bit in so we've determined one of the roles we can play is really supporting childcare centers, and doing the prevention work to support children who are in those settings so that they're having the best experience possible and their families are getting the support they need. We can provide high quality individualized therapy for children and families. The question is, we can't afford to keep those children and families in care in perpetuity. We just can't do therapy for the same, right now we have the capacity to serve, maybe 100 families at a time. We can't keep those 100 families in care, same 100 families in care for 3 to 4 years. We're not serving enough of the community at that point. But the question is, that's probably not necessary. How do we better understand what are the essential things that we need to provide to children and families to fully address what they're happening, but then also provide them educations and supports to let them go and, continue to thrive. So some of it is understanding kind of where the limits of what we can provide and what we should be doing so that we can continue to provide those things to more and more of the community. So again, the goal is not to get everybody in therapy and to keep them there, but identify those families who have very specific needs. What can we do to address those needs immediately and to provide them the supports to set them up for success later. So some of it is just honing down on what's essential and then provide that to as many people as we can. Same thing with the testing. We know there are lots of people that can do testing, but our sweet spot is really those families who can't afford to get their children tested anywhere else because they can't find a provider that takes their Medicaid or their insurance. So it's really trying to carve out parts of the population and say those are our people. Those are who we can help. As we move forward, thinking about the future, there's always going to be these changes in the ecosystem. And we are in a unique position because we're a nonprofit and because we have done a lot of things, we can adapt, we can evolve. So if something changes, and then there are new gaps that appear, we can maybe move over into that space. So for me, it's always being nimble enough to say, okay, we know what the community needs. We know where the gaps are. We know what our competencies are. How can we move to those places and make that work? Because I think that is a great opportunity for us to now build a really strong case for the community as to why we're an important piece of the ecosystem, because we have that flexibility. We have that ability to be nimble and to fill those gaps where maybe some other larger health systems don't. Or individuals who may think that's important, they can't make a sustainable living doing that because it hasn't really been identified. It's a gap for a reason. And that's what I find is that, this is where the hard work is. Gaps exist for a reason. Someone wasn't thinking about it. A population got left out. It's a very difficult problem to solve. So it's a gap. That's where ACGC, I think, provides kind of a unique role in the ecosystem as we can move into those gaps.
You've mentioned some amazing wins. Is there something that you're most proud of over the last 2 years?
Yeah, that's a really good question. I think that it's the resilience because there have been a lot of headwinds. We've had a lot of challenges. There's been a lot of changes, both globally, like with the pandemic. Overnight we went from 100% in-person therapy to having to pivot almost entirely to teletherapy. So, I mean, that was a huge lift. And I think, the shifts in the workforce, all of a sudden, we weren't the only ones who experienced it. Lots of industries experienced it. People can work from home now. And it's really attractive and good for their own mental well-being, their own family life, their own goals to be remote. The challenge for us is like remote teletherapy doesn't work for every person. So we've got to have some folks who want to see people in person. So being able to respond to the shifts in the workforce, because there are a lot of therapists can make a good living just doing teletherapy from the comfort of their own private home office with a population that is paying them what they're worth, and not having to do reimbursement, with insurance companies. So being able to make the case and support and attract high quality therapists who want to see people in person and work for a clinic as opposed to doing private practice, I think has been a challenge. So I'm really proud of the team that we've recruited, because I think we have people who want to be here, who are excited by this work, who really want to do kind of the diversity of things that we need to do for the community. But the question is it sustainable? So I think for me, like every day that we exist, I'm proud, because it's one more day that we can provide these services for the community. My longer term concern is like, how sustainable is this? And without shifts to the system or figuring out, how to do this so that the community never has to worry about, are we going to be around? And I know that sounds weird coming from an organization that's about to celebrate 75 years in the community, but I want us to be around for another 75 years. And some of the changes that we've talked about with mental health, or quite frankly, some of the changes we haven't seen yet, are giving me some concern with how sustainable, organizations like ours are going to be able to be in light of all of the needs that are happening.
Got it. Let me think. How can people join the cause?
Yeah. So we are very, very engaged in community outreach right now, because I want people to know that we are here for them. I want people to know how they can access our services. I want them to know that, we understand that there's still a lot of stigma around mental health services. So to provide ways to connect to us in ways that feel comfortable and meaningful and consistent with their values, and that we're here for everyone in the community. Now, it doesn't mean that we can serve everyone. I mean, we definitely have limits. We know our lane. If someone is experiencing a mental health crisis, if they are, for example, if they are experiencing a substance use disorder that is really acute, they need detox. They need to be in a rehab program. That's not us. We can provide referrals to partners who do that. Same thing with eating disorders. If it's something where someone is at risk for hospitalization because it's so severe, that's beyond our capacity for our clinicians to serve. But there's lots of folks who are struggling with anxiety, depression, OCD, who have ADHD and executive functioning deficits, who are on the spectrum and need support. Families need supports. There's lots in that area. Just children who are going through a rough time, loss of a parent, grief, bullying at school. They're going through a rough time and they need supports, and maybe just skills and, somebody to listen to them that can provide them with some guidance as to how to address life's challenges. That's really where we step in, and at the same time, provide that training to parents and caregivers and how to support their kids. So, for me, that's kind of the main thing, is letting people know, like, we're here. So, if you're part of a community organization, if you're part of a group that serves family and children, and that your clients, your constituents have needs, how do you communicate to them that ACGC is here? So providing those referral patterns. Definitely volunteers. Like, we have lots of opportunities for people to volunteer with us, because I cannot afford to pay, everybody, who contributes to our cause. So we have volunteers of like people who can welcome clients into our building. We have play leaders who come in and entertain kids while they're in the waiting room. We have folks who work in our healing garden who come out and just want to do gardening work with us. Because that provides a therapeutic space for our clients, and our therapists can bring families and be in nature with one another. And that provides a lot of healing for some families. So working in our garden, answering the phones, doing administrative work. And at the same time, we have an incredible group of leaders from the community who sit on our board of directors, who volunteer with our committees, help us to raise money in the community. That's always, absolutely necessary and welcome. And then lastly, just, if you believe in accessible, affordable mental health services, that everyone should be able to have those in our community, no matter where they're from, what language they speak, how much money they make, what parts of the community they live in, what they're struggling with. If you think children and families deserve to have access to services to help set them up for success later in life, and want to support that, donate. Amazing. That always is helpful.
Andy, thank you so much for joining us. Is there a best way for people to reach out to either you or ACGC?
Sure. You can contact us. We are on the web. So our website is austinchildguidance.org. So just go onto our website. You can find all of our contact information there. You can send us an email, give us a call. Let us know what you have either in way of needs and how can we help you with that. Or if you have the desire to serve, we can connect you with opportunities there.
Amazing. Well, I hope nothing but the best for the future of ACGC.
Thank you.
And I know there will be more conversations to come between us.
Yeah. Thanks so much.
Thanks so much for coming down.
All right. Thanks, Cody.
This podcast was presented by thecentralstate.com. Thecentralstate.com is a consortium focused on improving resilience in Central Texas by using evidence from research to improve human and community health. This website highlights health and research data by county and opportunities to find funding and resources for mental health programs in our area. Additionally, there are interactive calendars that keep you up to speed regarding what is happening right here in Central Texas.